All right. Hi, everyone. Welcome to pre-health shadowing. This is our live session today with Dr. Sosa. I'll be going over a quick startup presentation to welcome you all and introduce you to our program and the opportunities if you have not previously attended our shadowing sessions. So, pre-health shadowing is essentially an international student-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter the demographic status, abilities, or location. And my name's Leanna, and I am a live sessions volunteer at Pre-Health Shadowing, and thank you all for attending today. So just a PSA, we have closed captions to accommodate students of all abilities and needs. If you have any ideas on how we can be more accessible, please email us at info@prehealthshadowing.com and save us as a contact to keep us out of spam and join our email list to never miss a session. If you'd like to stay in the loop, you can follow us on social media. We're most active on Instagram and LinkedIn, or sign up for our email list on our website to never miss an upcoming session. And then since this is an international program, we want to know where you're Zooming from today. Drop it in the chat. I'm personally calling from Los Angeles, California. Okay, Washington, D.C. It's looking like a lot of like the US. Right, great. Texas, Arizona, Illinois, San Francisco. Our professionals from San Francisco. This is great. Okay. Wow. Okay, so moving on, if you want to get a little bit more involved in pre-health shadowing, um, we would love for you to join our network of student volunteers. As a volunteer, you'll be welcome to join any department and gain vital experience in various skills. This is completely remote and offers this flexibility to volunteers at all hours of the day from the comfort of your home. So even if you have 1 hour a week to devote, we highly recommend joining. And additionally, we have our leadership team, so you're able to lead students in various projects and initiatives, again, 100% remote, and positions are generally a minimum of 5 hours a week. So you can apply online at our website. Leadership roles are included in this list and can be found more in the following chat or at the bottom of the slide. If you notice, we have more coming, and to create like a new position, if you believe there's a strong benefit for it, you can also click the following link or in the chat and just look on the website. Yeah, if you're unsure where you'll fit, the best one would be like during the interview station, so no worries there. And if you are a high school student and want to get more involved, we have our HTP or high school training program for PHS, which allows you to connect with college pre-health programs and get involved in fundraising for PHS and organize resources for other high school students interested in medicine through pre-health shadowing. If you're interested, follow the interest form link in the chat. And lastly, if you can, we humbly ask that you donate to our program. We're an organization that has remained free for all students and run solely off of our supporters. If you're working around the clock, we're working around the clock to keep this free, so to make it accessible for everyone. And Zoom and our website are unfortunately not free, so any contribution you can give would be greatly appreciated. Any donation, even $1, but we highly appreciate your time, so donating your time was amazing. And throughout the session, we encourage you to drop any questions you have for our speaker in the chat. Our co-hosts will ask them throughout the Q&A, so we will be keeping track of your questions. And next, take good notes. Our post-shadowing assessment will be available to earn your digital shadowing certificate to verify your hours on our professionals course page at prehealthshadowing.com. And lastly, please turn your cameras on. This by no means is an obligation, but it does help us feel closer together. So with great appreciation, I'd like to welcome Dr. Sosa. Thank you so much for joining us today and donating your time to speak with us. You're welcome to start whenever you're ready.
All right, thank you so much. Let's see, let's share. Can you guys see that?
We sure can.
Okay, all right. So great. First of all, let me express gratitude to the organization, Pre-Health Shadowing, for allowing me to join you today. And I am still at work in San Francisco. I know some of you may be watching from bed over in the East Coast or something, or in Europe, but I'm still at work. I'm here in my white coat. I still wear a white coat. Everyone else in San Francisco wears polar fleece, but I have a white coat on and I got my scrubs on, and I literally was in the operating room up until just a couple of hours ago. So please excuse the bad hair. But I'm really excited to talk to you today because I feel like I am the luckiest person in the world to be able to practice the craft of surgery. And I wanted to really share that passion with you. And I thought I would give you sort of a personal story, telling you about who I am and how I got here, and maybe the lessons to be learned, or don't do it the way she did it, but we'll see. And then I thought I'd share with you kind of what I do as a surgeon and a scientist and a teacher. And then I thought I would finish by sort of sharing with you some broader lessons, sort of takeaways from the presentation. And then, of course, we have time for questions at the end. So that's the organization of today's presentation. And I'm a surgeon. I'm a cancer surgeon, actually. I do thyroid cancer surgery. I'm also the chair of the Department of Surgery at the University of California, San Francisco. And that's a very large, complicated department, about over 200 surgeons that span San Francisco, Oakland, and Fresno. And this is one of our seven UCSF campuses in the city of San Francisco. This is called the Mission Bay campus. It's where we do cancer surgery as well as where we take care of children. It's one of our children's hospitals, and also where we take care of women who, that's usually defined as mothers. And so our birthing center is on this campus. And I like to show this campus because it's sunny in this part of San Francisco. So it shows very well in slides, but it's not where I work. And so if you're wondering, where is Dr. Sosa right now? This literally is me. I'm on a different campus. This is Mount Sutro, the Parnassus Heights campus. And this is Moffitt Long Hospital. And that's literally my window. And if you were looking out of the window, which I'm doing now, I look north at the Golden Gate Bridge. And so it is absolutely soothing, and it keeps me calm whenever I'm having a stressful day like today. The unfortunate problem is it's near the inner sunset and the fog. So Carl the Fog works very close with me here at Moffitt Long. So so when I'm not doing surgery and I'm not doing research and I'm not teaching or having a difficult conversation, I love to read. And one of my favorite things to do is to read poetry. And one of my favorite poets is Robert Frost. And there are many Robert Frost poems I like, but this is one of my favorite frames. Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. And I think the point here, right, is probably through pre-health shadowing, you've met lots of people. Many people may have been on the superhighway from birth to medical school and becoming a successful physician. That was not my pathway. And I'll tell you about my pathway. Mine was very long, very windy, lots of speed bumps and holes and traps, speed traps. And yeah, that was my path to where I got. And I don't regret it. I actually think sometimes when you take the longer, more interesting path, it challenges beliefs that you have. Sometimes you change your beliefs, which I have done many times in my life. Sometimes it affirms your beliefs, but it's still a super useful exercise. So a little bit about me to start. I'm kind of a wacky person. I was born in Canada. I was born in actually Montreal. My dad was from Central America. He's now passed, and I miss him very much. He's from Guatemala. My mom was from Canada. And I grew up there for the first portion of my life. And then I moved to New York, and that's where I went to sort of end of elementary school, but really middle school and high school. Um, I then went to college in New Jersey. You can see the fact I graduated from college in a different century. And after college, I wasn't sure what I wanted to do. Medical school did not occur to me, actually. And instead, I thought I was going to be an economist. And I was going to do a PhD in labor economics, to be very specific. So I applied to graduate school, got in, and then I said, well, I got to prep for doing my PhD. So I decided to do a graduate degree, a master's degree in Oxford, in England. And so you could say, well, why did you ever think you wanted to do that? And the next sort of takeaway from my life is people. Individuals are so important. And I think sometimes if you think you know what you want to do, you kind of run into all these individuals in your life, but you don't see them because you've got your eye on some distant target. And I have always been easily distractible, and I live in the moment. And I really love individuals and individual people. And I talk to them, I listen to them, I stop in the hallway, and I think it's really changed my life. And so when I was in college, I met this guy. He was actually the president of the university, but he was teaching a class, introductory class in economics, macroeconomics. His name was William Bowen. And he changed my life because I just thought he was transformative and so smart. And because of the class I took with him and my interactions with him, that is why I thought I wanted to become an economist. And individuals have changed my life. And strangely, none of the people look like me. And they have very different backgrounds from me, but they still bonded with me. So I went to England. I spent 2 years there doing research in labor economics. And I specifically looked at the question, what was the labor market going to be like for PhDs in the arts and sciences? And I wrote a book with President Bowen for the Mellon Foundation. It was published actually in 1989 by the Princeton University Press. And basically what the book found, cut to the chase, is that I wasn't going to have a job as a PhD in economics. Literally, I was going to be unemployed because there was an excess of PhDs. So there I was in England, planning to come back and do a PhD. And I did this research that showed I wouldn't have a job. So I believe in science and evidence. And I was like, I got to change what I'm doing. So I called my parents, and my dad was a physician. My mom was a nurse. And I said, I don't think I should do this PhD. So they said, what are you going to do? And I said, I don't know. They're like, be a doctor, because doctors always have a job. So I was like, well, it's maybe not the most compelling reason to become a physician, but maybe that's truth. The problem was I hadn't taken MCATs, and I did a liberal arts degree, but I'd barely taken the kind of classes you need to take to go to medical school, and the requirements were different in the 1990s. So I looked at all the different medical schools, and there was one medical school that I could apply to without an MCAT, unless I wanted to go back and, do a post-bac. And that was a medical school in Baltimore. So I applied to a medical school, and I think they took pity on me. I don't know, but they let me in. And so I had an N of 1, and I went to the medical school that took me, and I was so grateful, and I will always be so grateful to Johns Hopkins for taking me late in the game. And I spent the next 12 years there. I was a medical student there. I stayed for general surgery residency and a fellowship and a junior faculty year. And it changed my life. And it largely changed my life because of people. Places don't change you. as much as people change you. And it was an individual, Neil Poe, doesn't look like me. He's actually an internist. And he was a researcher and he studied end stage renal disease, but he was a scientist. And he did something called health services research, which is like health economics. And I said, oh my God, it's somebody who's a doctor, but who values economics. And I know a lot about economics. So he changed my life by showing me how I could bring my former life to medicine and science and continue those studies. And the interesting thing is Neil Poe is now a chair of medicine here in San Francisco at UCSF at the Safety Net Hospital. So life is strange. You know, you meet someone and you think it's such a big world, and then you meet them again. And so remember, medicine and health and the world is much smaller than you think it is. So when I was at Hopkins, I again was transformed by an individual, and that individual was a pancreatic surgeon, and this was him. His name was John Cameron. Again, doesn't look like me. He came from the Midwest, went to Harvard, knew he wanted to be a pancreatic surgeon his whole life, but I thought he was so smart and so gifted in the operating room. So I decided I wanted to be a pancreatic surgeon, and that is what I trained to do. And then as part of my training, I said, I'm a very curious person. I loved England, and I would advise all of you to get outside yourself, travel, expose yourself to people and places very different from what you know, places that make you uncomfortable and stretch. So I decided to go and do 6 months of my training back in Oxford because I at least knew what Oxford was like. And this is the hospital in Oxford, it's the John Radcliffe. And I was randomly assigned to the breast and endocrine surgery service. So they did breast, thyroid, parathyroid, and adrenal surgery. And I did that for 6 months, and it changed my life again. And I hadn't done any thyroid surgery before. That's probably why I wanted to be a pancreatic surgeon. But I changed my mind. And I said, my God, this is awesome. And I was actually doing it because I was a senior resident. And I decided I love this gland. This is the thyroid gland. It sits in the front of your neck. It's the most beautiful organ. Looks like a butterfly. It's the size of a butterfly. And so I went back to Johns Hopkins after 6 months of doing thyroid surgery. And I looked for someone who did thyroid surgery. And that was this man, Rob Utelsman, who was the head of endocrine surgery there. And I finished my training studying the thyroid and endocrine surgery. He then went and became the chair of surgery at Yale. And he said, I'm going to recruit you to Yale. And that is where I went for my first faculty position. And I have to say, I loved doing thyroid surgery, but what I discovered is I really love teaching. And I loved young people. And here I am working with a student and a resident in the operating room. I then spent a lot of time with residents and students. And that's really why I'm here today, is because when I'm retired and beyond retirement, when I'm gone, no one will remember me probably for the books or the articles that I wrote, but maybe the people will remember me whose lives I touched. And many of these people who were very young then are very old now. Some of them are chairs of surgery and vice chairs of surgery and full professors of surgery, and I couldn't be any prouder. So I spent 11 years at Yale teaching and doing surgery. And then I was recruited to Duke, and this is Duke University down in North Carolina in Durham. And I was recruited there to lead endocrine surgery there. And I spent 6 months there before coming to UCSF. And I came to UCSF really to lead the Department of Surgery. And I've been here now for going on 9 years. And I love UCSF. I love San Francisco. Being chair is really hard, but probably the happiest times in my day are being in the operating room, taking care of patients, curing patients of cancer, teaching students and residents in the operating room, and then trying to make our field better and improve the care we provide to our patients. And we do that through science and research. So what do I do each and every day? So this on the left is a picture of the thyroid, butterfly-shaped organ, sits in the front of the neck. This is the picture I show to my patients in clinic. It looks pretty simple, right? But the picture on the right is from the textbook about thyroid surgery, and it's actually what you need to know to do thyroid surgery safely. So what's my point? It's actually wicked complicated. It's very complicated for many reasons, many different structures that you can easily injure that can change a patient's life. They could lose their voice. They could lose their ability literally to breathe and may require a tracheostomy. They may go into tetany, where their fingers get all bound up, or their heart stops because you've injured their parathyroid glands, or they bleed. And in the old days, when people started doing thyroid surgery, nearly 100% of patients died during thyroid surgery from bleeding, a massive hemorrhage, because of all the blood vessels that surround the thyroid and that can be injured. So I'm not going to show you any gross photos, but sometimes usually the thyroid is a butterfly-shaped organ, but sometimes it's not. And this is to give you a sense of why my days can be stressful in the operating room. And this was one of my patients who had something called a goiter. Goiter just means big thyroid. And her goiter was so big, she couldn't breathe. And the way she came to medical attention was she couldn't leave her house because her front door was about 10 steps up from the street. And she had discovered going grocery shopping, she could go down the stairs, but she literally could not get up the stairs. And she became my patient when the firemen went to her house when she called them and broke in and had to remove her in a stretcher because that's the only way that they could get her out safely. And so it became apparent that for her to have a normal, good quality of life, we would have to remove this massive goiter. And the interesting thing is all of her sisters, she had 3 sisters, they all had goiters too, so it was inherited. And just to cut to the chase, this is her picture on the left before surgery. And this is her picture on the right about a month after surgery. And we took her goiter out. She did exceptionally well. She returned to a very normal life, very active life. She then sent me her 3 sisters to take their thyroids out. But it just shows you how, as a surgeon, with a single operation, you can change someone and make their life completely different and almost always so much better. And she didn't have cancer. This isn't about cancer. This was just a big, giant thyroid. So as I said, early thyroid surgery was very dramatic and very challenging to do because surgeons and anatomists did not really understand the anatomy of the neck. And so this is a quote. I didn't make it up. This is from a very famous American thyroid surgeon. He actually was the founder of Jefferson University, Jefferson Medical College in Philadelphia. And he was the chair of the department. It was just a small department then, but he did thyroid surgery and he feared it the way most people feared it then. And I thought I'd just read this quote. Quote, "Can the thyroid gland, when in a state of enlargement, be removed with a reasonable hope of saving the patient? Experience emphatically answers no. No sensible man or woman will. Every stroke of a knife will be followed by a torrent of blood, and lucky will it be for him or her if his or her victim lives long enough to enable him or her to finish his or her horrid butchery." Close quote. Well, thyroid surgery, we've learned a lot over the last century or a century and a half. And these are four examples of patients about 2 weeks after thyroid surgery. And you see how we've really made this a very safe operation. We do them now almost always in the outpatient setting, removing parts or all of the thyroid in a very cosmetically pleasing fashion. And I would say if we took photos of these people about a year after surgery, many of them you wouldn't even know they'd have thyroid surgery. And through very small incisions now, we've learned how to take very big things out. Sometimes they're thyroids that are not cancer, they're just goiter. And sometimes they have cancer in them. And this is an example of a specimen we took out of a neck. This is the thyroid here in the middle with lymph nodes that have cancer in them going down into the upper chest. And then this is on the left side of the neck and on the right side of the neck. And you can see some discoloration, dark things. Those are lymph nodes with cancer in them. Well, that's what I do in the operating room. That's what a thyroid surgeon does. They take thyroids out and they try to do it safely. Sometimes they do it because patients have nodules, sometimes because patients have big thyroids, sometimes because patients have thyroid cancer, and sometimes because they have overactive thyroids or what we call hyperthyroidism. When I'm not being a thyroid surgeon, though, I love to do science. And that to me means innovation and discovery. And the only reason I think to do science as a physician or a surgeon is to do science to take better care of patients, to advance the field and afford them a better opportunity for a perfect outcome. Sometimes it may be trying to cure cancer or prolong life. Sometimes, like the patient I showed you, it's about restoring quality of life so that they can enjoy that life. So I do different kinds of research, and certainly I can answer questions that you have about all the different kinds of research that I do. But I thought it might be useful to focus a little more in depth on one kind of research, which is stem cell research. And I thought I would specifically talk about stem cell treatment for the management of something called hypoparathyroidism. Again, just everyone by the end of this session will know what the thyroid is and what it looks like and where it is and all the different forms it can take, big and small. But here's the thyroid, and it sits in the front of your windpipe, which we call the trachea. And next to the thyroid, actually on the back of the thyroid, are four tiny glands called the parathyroid glands, or parathyroid meaning around the thyroid. And these glands are very tiny. They're about the size of the tip of a pen, okay? Now, these glands can get sick. And when they get sick, typically they get overactive and they make too much parathyroid hormone, and the patient gets something called hyperparathyroidism. But what I want to focus on today is the thyroid to try to keep things simple. And the fact of the matter is, when we go to take the thyroid out, it can be very hard to see these parathyroid glands because they're so tiny. They're about the size of the tip of a pen. And we actually use special glasses or microscopes to see them. And I do a lot of thyroid surgery. So on average, I think I can probably do it safer than most people. But the average surgeon in America who does thyroid surgery, they only do one thyroid operation a year, which I'm sure you would agree is not many, right? And so if you don't do a lot of surgery on the thyroid and you only do one a year, you might imagine it's a little harder to do that surgery. You have less practice, and in the end, practice tends to make perfect. And so what we know is, in the hands of a low volume surgeon, these little parathyroid glands are more often injured or even accidentally removed during surgery. And when that happens, the patient is left with this condition called hypo, or too low, too little parathyroid hormone. Okay? It is also possible when a baby is born, if they have certain genetic abnormalities or mutations in their genetic makeup, they can actually even be born without any parathyroids, in which case they have hypoparathyroidism at birth, and that is life-threatening. So hypoparathyroidism, whether you're a baby or an adult after thyroid surgery, hypoparathyroidism is life-threatening. And so in medicine, we've been thinking for a long time how to treat it. And so one idea I had was to use stem cells to treat it. So some of you may know what a stem cell is, but I'm going to assume that some people don't know what a stem cell is. And stem cells are really cool. They're cool because they are cells that don't ever die. They have the ability to self-renew. And so they are infinite, potentially infinite in their life. They're also very cool because they can differentiate, meaning start as something that can become anything, and then with manipulation or exposure to different chemicals or different hormones, they can go down different pathways to become different kinds of cells, like skin cells or blood cells or nerve cells, or in my case, what I'm trying to study, parathyroid cells. A lot depends on where they come from. So there's human embryonic stem cells. Then there's these pluripotent stem cells, or iPSC, that we get from donors. We can get them from people, or we can get them from cultures that we maintain and curate. And here's what they can do. You can start with a stem cell, and through manipulation of the stem cell, you can make blood cells or nerve cells or heart cells, which is pretty amazing. So here we are looking, and this is literally a petri dish taken from my lab when I was at Yale University. And I hope all of you on your screen can see that the little cells are beating. So what went down was, it was one night, I was asleep at home, and I got a text on my phone to call the lab immediately. And it was one of our lab scientists, and he said, "Dr. Sosa, we need you in the lab right now." And I looked at the alarm clock, and it was like 3 a.m. And I was like, I am in bed. I am not coming in the lab. What happened? Did a pipe break? Are the lights out? Are the electricity out? What's going on? He goes, "You need to come and look at what we're looking at under the microscope." And he had gone in to feed these cells. And to feed them, he was making sure they were healthy under the microscope. And he encountered this. So who wants to come off mute and guess what he was looking at? What kind of cells had these inadvertently become? What do you think? Okay, Mohammed has raised his hand. What do you think?
I think heart cells.
You got it right. So we didn't plan this, and this is something to know. Like life, it goes back to all these twists and turns my life has taken. Like I was going to be an economist. I didn't. I was going to be a pancreas surgeon. I didn't. It's, you go through life, and it's good to have a strategic plan, but sometimes life takes you in different directions. And, sometimes you go with it. It takes you down incredibly cool pathways. So we had been studying, and for years had been trying to create parathyroid cells. And then one night at 3 a.m., we realized it was really powerful what we had done. We had created a heart cell, but that definitely was not what we tried to do. But it's an example of where science can take you in different directions. Well, here are all the different kinds of organs now that people are using stem cells to create. And while it was cool to make a heart cell, and I sort of turned the discovery and the experiments over to people who understood vascular biology and heart biology and embryology, I was still really motivated to try to make parathyroid cells. So this is a picture from the operating room, actually. And here at the top, you see the thyroid gland, that beautiful butterfly gland. And this is under much magnification. You see arrows pointing at this golden orange organ. It's magnified many, many times here. And here's the second one, both on the right side. And those are the parathyroid glands. And they only look this big when you have on those special glasses or microscopes. So when patients, little babies, are born without parathyroids, they can die if you don't find a way to give them calcium quickly and vitamin D. Similarly, if a surgeon inadvertently steals the blood supply to the parathyroids or inadvertently injures them or removes them, the parathyroid hormone levels, meaning the levels of hormone made by those glands, falls because the glands aren't working right. It's very difficult to replace parathyroid hormone through pills or IVs because the half-life of the hormone is so short. And so what happens to those patients is their quality of life deteriorates. And they often require not only taking calcium and vitamin D every day, but almost on the hour, at the hour, they have to take supplements. We have tried transplanting parathyroid tissue from a different person to a person without parathyroid glands, but we've seen people reject parathyroid glands, sort of like when you do a liver or a kidney or a pancreas or a heart or a lung. They reject the parathyroids, and it's very hard to get parathyroid transplants to work. So what we said is, wouldn't it be cool to try to use stem cells from people to replace the parathyroids if they don't have them? And so the idea would be, you take a patient, say, whose parathyroids were injured or they were born without them. So they don't have any parathyroid glands. So what we would do is go into the inside of their mouth and scrape the mucosa, okay? So those are mucosal cells from the inside of your mouth. They're differentiated. You then take them to the lab and you expose them to chemicals and hormones, and you drive the inside of the mouth cells back to a stem cell. So it de-differentiates to a stem cell. And then you take that stem cell, but it's their stem cell, right? It's not a foreign one, it's theirs. And then using a different set of hormones or chemicals, you drive the stem cell not back to mucosa from the inside of the mouth, but to a parathyroid. And because it's their own, they won't reject it. That's the idea, okay? So how do you do it? Well, you've got to figure out how to replicate embryology, meaning the way you were when you were in your mama's womb, right? When you started out as a little blastula or gastrula or morula, just a little lump of cells. And then, as you grow as a fetus, you develop different layers of cells. Then those layers of cells differentiate into three broad areas in the body: the foregut, the midgut, the hindgut. The parathyroids come from endoderm, then they go into foregut, and then they go here into the region of the thyroid, but it becomes the parathyroid, which is very different from the midgut, which gives rise to your gut, your intestines, or the hindgut, which gives rise to your large bowel or your colon. So you could say, well, Dr. Sosa, that all sounds very complicated. How do you know? Like with a heart cell, we could see it beating. But with a parathyroid cell, how do you know if you did it? Like, how do you know if it works? So we have different ways of figuring out if we're successful. One is we have ways to stain cells for unique characteristics. And here you see some, these are endodermal cells that are coming from the foregut. So they're staining well, suggesting they might be parathyroid cells. We also look at them, their shape, their size, other characteristics. So they're what we call their morphology. And these are favorable for looking like parathyroid cells. And that is ultimately how we answer the question. So you could say, well, Dr. Sosa, have you been successful? This is me. No, not successful. Maybe you'll invite me back in a few years when I've been successful. I would say we're maybe 2/3 to 3/4 of the way to making parathyroid cells. We have cells that have made parathyroid hormone briefly. We have cells that have stained positive for GCMB2, which is very important, but it hasn't worked yet.
When is it?
Oh, sorry, Victor. I can hear you. Oh, there he is. Okay. So basically, this is me. I haven't succeeded. I'm continuing to fail, but I'm always thinking and I'm always trying. So I'm sort of like a stem cell. I'm still here and I'm still trying to get to where I want to go, but I haven't quite gotten there. And so I thought that would be a nice place to now transition to just the final part of my talk, which is very brief. And then I hope to open it up for questions. And that is, maybe all of you, you're much younger than I am. You have more energy. You're probably smarter than I am, more courageous and more creative. So in many ways, you're undifferentiated still. Maybe many of you are going to go into medicine. Maybe some of you will be like me. You thought you were going to do something, but then you decide to be an economist or I don't know, something else, which is all cool. But I thought if we're all stem cells, what are some guiding principles to help us get to where we ultimately want to go? So I am not a good athlete, but I always try sports because I love them. They make me happy. And one thing I've learned in life, and definitely in medicine, and certainly in surgery, is you can't do things by yourself. I know some of you probably think you're Superman, Superwoman, superhuman, but in the end, life is really hard. And the only way to get to the end is to work together with people. And so that's the idea of a team sport. And in surgery, we always work as a team in the operating room. We have a team made up of anesthesiologists that put you to sleep, surgeons that cut things out and sew them back together, nurses who help us to do the surgery, staff who get equipment and move the patient back and forth, students who retract and are learning such that when I'm tired and old, they will take over and do the cases better. And so all of us have strengths and weaknesses, and that's why teams allow all of us to use strengths that are complementary to cover for our colleagues' weaknesses. We always have to play by rules and boundaries. Ultimately, the best teams have to agree on our goals, which hopefully in surgery and medicine are to take the best care of patients. And like I said, the more you do, the better you are. So practice makes perfect. So practice, practice, practice. You also can't do it by yourself. You need people smarter and older than you who've been through it all before, who've made mistakes. You don't need to repeat their mistakes, but learning from their experience is really key to avoid that. So I always try to find people who are smarter, usually older and more experienced and wiser than I am. I ask them to tell me about their successes and their failures, and then I try to learn from that to do better. If I can, I try to recruit those people to coach me, to actively try to make me better, and that's called a mentor. Okay, so a mentor is like a coach. It could be your parents, it could be a friend, it could be an aunt and uncle, it could be a teacher or a counselor, it could be none of those things. It actually could be your coach if you're on the soccer team or the swimming team. Well, I told you I love to read, I love poetry, and I love the classics when I was in college and high school. And so I don't know if any of you know who Mentor was, but Mentor is a character, right, from Greek mythology. And in Greek mythology, Mentor was the son of Heracles, okay? And he was put in charge of taking care and teaching and guiding and counseling Telemachus. And Telemachus was Odysseus's son, okay? So that's who he was coaching. Now, the funny thing, kind of the interesting twist, is that Mentor was actually Athena, the goddess. Athena disguised herself as Mentor and really advised young Telemachus on many, many matters. So it's sort of a bait and switch type of thing there. And it just goes to show you again, you think you know truth, but you may not. And that's why science is really, really cool. So what is a mentor in 2026? Obviously, there's no Athena, there's no Heracles, there's no Odysseus. So a mentor is someone who imparts wisdom to or shares knowledge with a less experienced colleague. So it's kind of like been there, done that, right? You know those people like, oh yeah, I've been there and I've done that. And this is what I learned. These are some fish in a fish tank. So you could say, okay, I'm going to go out and find myself one of these magical mentors. And I showed you some of my mentors like Dr. Cameron, Dr. Bowen, Dr. Poe, Dr. Udelsman. Well, it's really good to find a mentor, but they're not a panacea. In the end, we all have to own ourselves. We are who we are. Mentors can shape us, they can help and promote us, but in the end, we have to own it. Like, we need to take responsibility for our own successes and our own failures. And sometimes some of us try to fool ourselves that we're the little kitten looking in the mirror and we think we're a big fat lion with a mane when in fact we're just a baby kitten. So don't lie to yourself. So how do you know a good mentor if you find one? Like, what's a good mentor? So it's someone you respect, someone who's had success. So someone maybe like you maybe want to be like. You need to not just respect them. I honestly think you have to like your mentor. You know, some people you respect and you dislike them. That's not a mentor. It's someone you like and respect. Should be someone with good interpersonal skills who you like to spend time with. It should be someone who has a track record of mentoring others. So it's kind of a tried and true thing. It needs to be someone who has time to spend with you. Like, it could be the nicest, most famous, smartest person in the world who's mentored hundreds of people. But if they're so busy mentoring 100 other people, then they're probably going to do a bad job mentoring you because they don't have time. And ultimately, it has to be someone you trust, right? Because they know the bad and they know the good. So it has to be someone who can do tough love. Like, they criticize you and say, you know, you're great in so many ways, but you're also kind of could do better. And these are those areas. A lot of people don't like saying that. So it has to be someone who has the courage to say that. And it's someone who has to know you well enough to know that, yeah, you have this flaw, but we can fix the flaw. And then we can maybe make you better than even you think you can be. You have responsibilities too. It's not all on the shoulders of the mentor. You have to be introspective. Like, you can't be like the mentor tells somebody says, you know, you're abrupt, you're kind of rude. You know, you need to slow down and be nicer. And you have to be able to take that and say, you know what? I see that. Yeah, okay. That's an opportunity for me, and not just say that's not true. You have to ask for advice. Most people won't give you tough love unless you ask for it. I think as a mentee, it's important to talk to many people to know who you click with. So you have to be willing to go experiment with people and spend some time doing research. And you have responsibilities. Like, if someone's going to make time to spend with you, you have to, like, be grateful, right? Like, usually people don't pay mentors like, people don't pay you to give talks, but you give talks because you really care. And you do it because you care, not because of money or anything else. But what really makes a difference to mentors is for someone, could be just one person who says, you know what? Wow, you rock it hard. Thank you so much, right? And so always say thank you. Like in the old days, my mom used to make me write a thank you note. I still do that actually. Or I go and buy a card. You don't need to do that, but even a text like, hey, man, that was awesome. Thank you so much. Like it totally makes, like I see our faculty when they're smiling going down the hall and I go, why are you smiling? They're like, oh, my student just said thank you. It's like amazing. Their whole face lights up. It's so cool. Bring enthusiasm and hard work, right? People, like if everyone around you is working hard, you work hard, and then you all work hard together, and it makes it kind of fun actually. Show up. So don't, like, if your mentor's like, I'm taking time out of my sleep to get up at 6:30 in the morning to see you, don't no show. Right? Like, show up, like put your alarm clock and your watch and your friend's watch, so you don't oversleep. Communicate. All right. Be fair, be honest, speak up, don't tell lies. I hate lies. People lie all the time. If the relationship feels artificial, like actually change it. Like if it's like, you know what, we're not clicking or jiving, or you get the sense your mentor is, probably it's good to stop wasting time and just say, you know what, doesn't feel right. I don't want to take up more of your time. And people will appreciate that. They will. And then the appreciation. And then the last thing I just wanted to say, you're probably thinking, God, that Dr. Sosa, kind of a loser. She's like still sitting in her office talking to us. Why isn't she with her family? Why isn't she with her friends? Like, that's pretty important. And I have to say, if you are thinking that, that's actually pretty wise of you. And I think that when you're a physician, like taking care of patients could take up every minute of every hour of every day of every week in your life, because there are always sick people who need help, whether it's surgical help or medical help. And so there are some people who just feel like they need to do that 24/7. But I'll tell you, and I'm not the oldest person, but I've lived long enough to know you won't last long. It will destroy you, and it will destroy your family. And so all of us need to work to try to find a way. I don't know, balance isn't the right word. I like integration, because in the end, they're not this and that. They actually overlap, and they intersect in any day or any hour in any week. So you actually have to give yourself grace and make time, but actually always prioritize first yourself, your own mental health and your physical health. Because if you're just run ragged and you haven't slept because you're just worried about your patients, you're sleeping next to their bed in the hospital, you're going to be asleep and not thinking right. You're going to take bad care of them. And you're also not going to take care of the people at home who depend on you, whether it's family or friends or both. And I would say this is not a staged photo. They show this at holidays in my family, because I'm always late to Thanksgiving dinner and Christmas dinner and this, that, and the other, because I'm literally, like, this is in our kitchen actually. And they actually literally brought a comfy chair into the kitchen because I fall asleep so often in the kitchen while we're eating or cooking. And I often do it because I'm doing the EMR. I'm trying to do my medical records. And my dog, this is Mary Pink. She's one of our dogs. She's lovely, and she helps to take care of me. So to finish, I love what I do. Being a surgeon specifically is the most wonderful, rewarding career. I love taking care of patients in particular. I love the operating. I love the fine work and the ability in a couple of hours to just totally change people, almost always for the better. I love teaching and young people, and I think I'll always try to find ways to do that. I'm working harder and harder on trying to make some time for myself. And when I spend time with myself, sometimes it's by myself. I just need to be with myself, sort of thinking through things that have happened that are kind of heavy and hard to think about. And I'd recommend you all do that. I think that's something that people don't do enough of, is they're uncomfortable being alone. I love being alone. But it's also about your family. Sometimes it's your children, which are super important. And sometimes your family are the people you work with. And this is my family, my work family, the Department of Surgery at UCSF. And I did want to show this photo because I think a lot of people also have this myth that surgeons are really serious people, like on Grey's Anatomy or something. And they're always yelling and they're always upset about something. I don't know. There's all these legends, and they're legends. They're just that. They're stuff from the past or stuff from movies and plays, and it's really not contemporary. We're actually, this is our department, very diverse community, and often a really, really happy community because we love what we do. With that, I will finish. I'll stop sharing and open it up for questions.
Thank you so much, Dr. Sosa. We learned so much. Um, for everyone that's like asking questions, feel free to raise your hands also if you want to like speak on the mic and ask Dr. Sosa yourself. Otherwise, I'll say your name and also help you with questions. So if anyone wants to raise their hands now, feel free. Otherwise, I'll get started with our first few questions. Okay, Mohammed, if you'd like to go.
Yeah, I'm just gonna ask my question out loud from the chat. So you mentioned kind of striking, but earlier was balance, but now it's integration. You said that there's no I in team essentially. So I'm kind of asking, how do you kind of strike a balance in striving and working hard, being independent, versus like acknowledging when you need to ask for help?
Oh, wow. I hope all the questions are not this hard. This is this is gonna be a long 30 minutes. That was a great question, Mohammed. And I wish I had a good answer to it. I think that first of all, I'm not sure I've reached nirvana. I haven't reached that one thing. And I think very few people have found a way to do that. And I think the truth of the matter is, in the world, in the United States, but I'm not picking on the United States. I think in the world right now, there is a lot of unwellness. You know, we've been through a hard patch as a world, as the earth. You know, the pandemic like made people sick. It killed so many people. It isolated us, right? We all became so lonely and afraid. And then, like, we emerged from that. And now, you know, we're in a world where many of us are worried about climate change, we're worried about war, we're worried about science and healthcare. We're worried about things we didn't worry about before, but maybe now we're worried. And that's not even our day jobs. That's just like the backdrop, right? So, and then we take, you know, jobs, and every job is hard. Like, I don't want to sit here and say, oh, woe is me, surgeon, so hard, medicine, so hard. It's hard, but it's so gratifying and inspiring and energizing. But you know, taking care of people when they're most vulnerable, when they're sickest, sometimes when they're dying, sometimes when they're alone, like it really weighs on you. And I think the biggest mistake I see made is something you just said, is not asking for help. Okay. And I see it actually. I was just talking to our interns today. Our new interns just arrived, and meaning they just graduated from medical school and they've arrived for their residency and they're going to be spending 7 years learning to be a surgeon. And I got up and I was like, hello, everyone, welcome. And I thought people would be smiling. No one was smiling. Everyone looked like they were very afraid, very, very afraid. And what I said to them, and I read the room and I was like, my goodness. So I said, I remember feeling that way. And I said, the most important thing you need to be comfortable doing is like asking for help. Now, that could be help like I'm an intern. I have a patient with low blood pressure who may be having a heart attack. I don't know. I don't know what to do because this is the first time I've ever done this. A, I could wing it. B, I could ask Claude. Or C, there's a colleague in the other room. Let me go get that colleague. And don't be ashamed or afraid to do that. But when I said to them, ask for help, the other thing I said is you have to feel comfortable asking for help if you need help. Like I'll give you an example. My mom has dementia, and she's uh, has very advanced dementia. And I worry about her all the time about whether she will fall or hurt herself, or all of the above, or wander off. And this kind of happened one day. And I was like, oh my God, like I was in the middle of a clinic. I was like, what am I going to do? And I was paralyzed. And then I was like, wait a moment, what do I tell everyone else to do? And I was like, I told the patient, first of all, I said, I am so sorry, but I'm having a catastrophe in my family. I need to stop our consult. We're not going to charge you. I'm going to come, we'll reschedule this for tomorrow, or I just can't do it today. And then I called one of my colleagues and I asked her, are you too busy, or could you come and finish my clinic for me so that I can go take care of my mom? And I was like, oh my God, she's going to think I'm so weak. And my colleague was like, of course, I'll be right there. And so what I learned is like, you have to ask for help. You have to feel comfortable doing this. You have to do it in medicine all the time, because even when you're the oldest, smartest person in the room, you're going to come across something you don't know how to do because you've never seen it before. And you're probably going to need help. But it's also like you may need help, like getting to the dentist, taking care of your mom, something else. And that's where, like, feeling that you can do that. And I don't know if we yet do it perfectly. In fact, I don't think we do it well. Probably in medicine, we still think we're too tough. Um, but maybe your generation will help us to be better at it. But this is exactly what I was talking to the interns about this morning. Does that make sense?
Yeah, it was a lot, but it made a lot of sense. Thank you.
Yeah. Well, life is a lot, right? All the time
Yeah. Thank you for
for all
being
of us.
vulnerable.
Yeah.
So our next question is from Pramod. He says, "Hi, Dr. Sosa. What would you recommend in high school to get into pre-med or like the medical path?"
Yeah. So thank you for that question. So the first thing I would say is, in the old days, like when I told you my story, remember only one medical school didn't require an MCAT. And when I went to medical school, like I was this weird person. And pretty much most other people who were there, even though my medical school didn't require an MCAT then, they all pretty much did pre-med. Like pretty much everyone was like a biology major, a chemistry major, or whatever. But you know what? That's not true anymore. So the interesting thing, like the medical school class here at UCSF, oh my God, people like have done all kinds of things. And I don't think it's just UCSF. I think we've come to understand the importance that our healthcare workforce be diverse in ways that reflect what our patients are like, right? Like, if everyone who's a doctor is the same, then how do you take care of patients who are never the same, right? And it's about building, I think, a diverse workforce. And so I think the important things are to pursue things that bring you joy. So don't do medicine because you're living your parents' life, okay? Um, do medicine or do surgery or do economics because that's what brings you joy. And I spent much of my life doing things that people told me to do, like literally, like my chair told me be a pancreas surgeon. So I was like, okay, I'm going to be a pancreas surgeon. Then I went, remember, to England and I did 6 months of thyroid surgery. And I was like, done with the pancreas, love this gland, got to do it. So I would say when you're in high school, try different things, see what brings you joy. You obviously don't take away from this that Dr. Sosa said, don't listen to my parents. No, I always listen to my parents, but, listen to your parents, but more importantly, listen to your heart. I would say in college, I believe strongly in liberal arts education, which simply means you don't have to major in English. I didn't, but try different things, try different classes. And there's still some colleges and universities, I don't know if they make you do things, but like they're like, please choose at least one course from these four broad areas. But the idea is expose yourself to different professors, different people, different subject matter, and you may surprise yourself. Whatever you do, though, you got to work hard. You got to go all in. You've got to work hard, read a lot, and some people don't learn by reading. Listen. It could be you do podcasts or blogs or whatever. Listen, however you learn, and do it really well. And what I have found, and maybe I'll stop here, is like you can do anything but not everything. Okay, there are a bunch of people running around who like say they do this and this and this, and I'll be honest with you, like I can't do that. So like I showed you all the things I do. Like I really love teaching the most. I'm not sure I'm the best teacher though, because I didn't study how to be the best educator. I just love it. I would say I love doing surgery. I love taking care of patients, and I've done so much of it that I'm good at it. But what brings me the most joy, if you told me, Julianne, you could only do one thing of all that stuff you talked about, I would do science. That's what, at the end of the day, I would choose. And for each of us, like I would say, what is the one thing? And then go all in and be the best in the world at it. That's sort of my advice about pre-med. And you could say, well, all right, that all sounds good, but how do I get started? Expose yourself. So I would seek out opportunities. So the ways you could do it would be family, friends, programs in your high school or local college, where you can intern or like go to the hospital, go to a clinic, go to a medical school, go to a lab, get exposed. And it won't be like you're doing the work, but it's like seeing what people do, seeing, like talking to them. What excites you? What do you hate about your job? Like actually not like taking other people's words for it, but talking to people. So I really believe in that. And I would do it in diverse settings. So like I love this idea of international exposure if you can, because the amazing thing is we do things great in the United States, but I'm not sure we always do it the best. And sometimes we get a little biased that we think we're the best at everything, when in fact, maybe we are, but actually maybe we're not. So I love going abroad, traveling. Traveling's good. And just watching how people do things. So in surgery, my favorite thing to do, clinical surgery, when I'm offered an opportunity to go abroad, I go abroad, like to give a talk. And a condition of my coming is, can I go with you to the operating room? So I stay an extra day, they get permission, and I go to the operating room and I watch them do a thyroid operation. And I always bring home a trick, like something I saw somebody else do that I've never seen done, but I'm like, that is so cool. I'm going to be better because I know how to do that. So those are just some ideas.
Yeah, thank you. So our next question is from Julie. She asks, or she says, "Hi, Dr. Sosa. Thank you so much for being here. Some questions she'd like to ask is one, your experience with burnout or advice in that regard. Two, your sense of work-life balance. I know you kind of touched upon that in your presentation. And then three, the biggest changes you anticipate in your field in the next 10 to 20 years."
Yeah, that's a big question. Burnout. Yeah, I don't know. Sometimes I like today was a really hard day for different reasons. So like tonight, when I'm done here, I'm gonna go home and we're going over to a friend's house, and there's no doctors. Like I actually spend a lot of my time when I leave the hospital not with doctors. Like my friends are not doctors, and it's because I just need to get away. I just need to talk about different things and think about different things and not worry. So that's one thing. What is the last part of the question I remember, which is what is the biggest change coming? I think everyone, I'm sure other speakers have said, AI is changing everything we do. It's changing surgery, it's changing medicine. But I think what is coolest is this idea of personalized treatment. And it may be through AI, it may be through science or other things. I think for a long time, like there was the way, Mandalorian there's like the way, like there's one way to do the best thyroid surgery and to do the best heart surgery and the best liver surgery. And this is the way you do it. And this is what the textbook says. But then you realize that people have different anatomy, they have different stages of disease, they have different other diseases impacting the disease you're doing surgery for. So every patient is different. And there is no the way. Rather, we should be able to design an approach to healthcare that is perfect for that person. And like I do cancer, like that kind of cancer, that form of cancer, and the cancer in that patient. And we've gotten a lot better at it. Like we use genetics, we use imaging. We're starting to use AI, but we're not waiting for that. We're using science, physical examination, history, environmental exposures. And all of this is allowing us to actually say to patients, we could do this or we could do that. And both A and B will get you to the finish line. And then instead of telling them what to do, like this is the way, saying, what do you want to do to the patient? And allowing the patient to take a situation where they could do A or B. They have different risks and benefits, and to exercise their values and preferences to choose the path forward. That takes a lot for a doctor to actually be quiet and let the patient speak. Now, sometimes there is the way, don't get me wrong, but in my area, there's A or B. You could do both. They'll probably get you to the same place. You could do drug A, procedure B, or neither. And I think the idea of personalized treatment and patient preferences, those I think are the biggest changes in my field.
Yeah, thank you so much with that. That was very informative. So our next question is from Quincy, and they ask, while moving from country to country or from medical school to medical school to lead in your program, did you get sponsorship? And also, how did it affect your family and relationships because of the movement?
Yeah, moving's hard. It's a great question. Thank you, everyone. Thank you for these really great, tough questions. Yeah, I don't, there's pros and cons to moving. So moving's hard. It's exhausting actually. And it's exhausting for you in your job because every time you move, you have to reestablish your reputation. You have to, meet people, new people don't know you. You have to, like I had a lab, you have to move the lab. Then some people don't want to move. So you got to hire new people. And so you lose time. Okay, so it sounds like, wow, that's hard. Why would you ever do that? Well, the reason to do it, I think, is to expose yourself to different things. And I've worked at each place I've worked at, I've worked with people who've done what I've done. I haven't moved a lot. I've moved basically like 3 times. There's a lot of people who've moved a lot. Most people move a lot more than that. But I've also worked with people who've never moved, okay? And while it's really good because it's more efficient to not move, the problem with not moving is you haven't been exposed to like the world and other ways of doing things. And the people who I've worked with over the years who've never moved often are set in their ways, very set in their ways. They're like, this is the way we do it. And you're like, well, you could do it this way. And they're like, no, you can't. No, that's wrong. This is the way we do it. This is the way we all do it. And you're like, of course, that's not true. But if you've never been outside meaningfully, like really experience the people and learn to respect and trust the people, then you treat the world a little bit with some skepticism. It's good to have cautious skepticism, but it's also good to have an open mind. So, I think you should make decisions about moving. Don't move just for the job. Make sure you move to a place you want to live. Make sure you listen to your family. And in many times, I've done what my family wanted to do, not what was best for the job. It took me a while to learn that, but I think that's smart too. And if you find a place where personally and professionally it feels home, then stay there.
Yeah, thank you so much for your insight and sharing your personal experiences. The next question is from Japneet. They asked, why do you think hypothyroidism is increasing worldwide? Is it simply just more screening and testing, or are there more environmental factors affecting people's hormones, resulting in increased rates of thyroid disorders or autoimmune diseases in general? Just curious because there's a lot of misinformation and discourse online.
Yeah, thank you for that. So, um, uh, there's like something like, I don't know, 20 odd million people on thyroid hormone in the United States. I'm on thyroid hormone. So, for full reveal, I have hypothyroidism. So, I take thyroid hormone. So, I love your question. I know why I have it. I have it because both my parents had it. So, some of it is inherited. Um, uh, we are learning that there are environmental risk factors. You've probably read about microplastics. That's one frequently discussed in cancer. Obesity, definitely a risk factor. When it comes to thyroid, tobacco and alcohol are protective, not telling you to go smoke and have a bottle of beer tonight, but it's interesting. We don't know why they're protective, but they're definitely protective. With thyroid, the things, though, specifically in thyroid that I might highlight, other than obesity, one is radiation. So, radiation exposure in childhood and adolescence is definitely a risk factor for papillary thyroid cancer. And the younger you're exposed, the greater the risk. So there's some well understood environmental risk factors. And then there's some new ones that we are only now exploring. And the example I would give you, I live in California. California is the home, the motherland of flame retardants, right? Like flame retardants were really, I don't know if they were invented here, but they were really introduced here, legislated here for good reason, because things would catch fire, like pajamas and drapes and sofas, and a lot of people died. The problem, though, is we now know flame retardants are risk factors, and potentially they may be a powerful risk factor for thyroid cancer. And flame retardants are very interesting. Yeah, there's the one like in old pajamas and like drapes and stuff, but any black plastic is potentially another source of flame retardant. So, like if you're looking at me through a large TV screen, that may be something. Cell phones, definitely. So we've done some studies that have definitely shown signal. So I would say, great question. Some things well understood, some things starting to be understood, and I bet you there's a whole lot of things we don't understand at all.
Thank you so much for sharing. I wanted to emphasize one more time, for anyone that wants to have their question asked next, we are approaching like our last few questions of the session. So please raise your hands if you'd like to ask them yourself. Otherwise, I'll be moving on with like the list that we have. So yeah, please raise your hands. Um, Okay, if nobody's raising their hands, then our next question's from Morgan. Oh, okay. Eileen actually is raising her hand, so feel free to go ahead, Eileen.
Hi, sorry, that was a little delayed. Thank you so much for speaking to us today. I just wanted to quickly ask, I don't know if you've touched on this a little bit, but looking back at your career, what advice would you give to a high school student who hopes to contribute to the research field? And as I know many high schoolers do, I know it's really competitive. So what advice would you give to someone in the early stages who hopes to kind of go down that pathway like you did?
Yeah, thank you for that. I'd look for opportunities like in the summer. You may want to talk to more senior, like, if you're in high school and you're a sophomore or whatever, ask the juniors or the seniors, what did you do? And sometimes like I caddied. I worked in a golf course because I was trying to make money, and you make a lot of tips carrying golf bags around. So sometimes we have to do what we have to do. But as I got older and I started to really like science, then I would look for opportunities. And it's asking people. I usually would ask people more senior. When you get to college, it gets easier. In any field, it could be in economics, it could be in science. You ask senior class, senior class people, like, who has anyone done any research? You can do it sometimes in the summer months. Sometimes they pay you to do it because they have grants to do it. Sometimes you can do it during the school year. A lot of people, like, one route is to volunteer to TA, like to teach a course, and you get to know the faculty member as like a TA for them. And then, you go out and you have coffee one morning. I've done this, and I'm like, what do you do when you're not teaching this course we do? And, I remember people saying, oh, yeah, I'm in the archives, I'm doing research. And I was like, that's so cool. What is that? And then you're like, do you need any help doing that? And I often had a job because I needed money. But then I'd be like, I'm going to make out several hours a week, like, for free doing this. Like, wow, like maybe I can get a publication, or maybe I'll see if I like this. And so seeking out opportunities sort of in that way, being curious, introducing yourself. You could, like, another thing is like when you get to college, right? Like, you'll read the school newspaper, and there's Dr., Professor so and so who just wrote a book about such and such. And you're like, wow, like, that's kind of cool. But it takes some courage to go talk to them, right? So maybe you take their class, maybe you make an appointment to go talk to them, maybe you find out who's in their class to see, do they do research, because this book is really interesting. So it's kind of like, you got to be resourceful and curious and kind of bold. Um, and that's the way I did. And I often offered to do things for free. Like, I had a job because I needed the money, but then to get traction, I would do a literature review. Like, that's not very glorious. Like, with PubMed or AI now, you do a literature review. But it got me as a co-author because I did the grunt work no one else wanted to do. And I did it for free, and they loved that. And I got to go to, like, the study meetings of all the other senior scientists. And I didn't say anything, but I, like, listened, and I learned so much from listening. Stuff like that.
Okay, thank you so, so much. Um, I'll ask for our final question if anybody is willing to take. Otherwise, we will be wrapping up the session. If anyone would like to raise their hands in this final. Okay, Raika, if you want to go ahead.
Hi, Dr. Sosa. I was wondering, for patients who've had thyroidectomies, they have to take daily medication for the rest of their lives. What happens when they can't afford that lifelong medication? Are there resources that clinics can use to assist them?
Yeah, thank you for that question. So, broadly speaking, sometimes we take the whole thyroid out and sometimes we take half of a thyroid out. Now, when we take out half of a thyroid, that's called a lobectomy. Most people can live on the other half, actually. Most, not all, most. So that's kind of cool. And we check hormone levels to see. But if we take your whole thyroid out, you're absolutely correct. You have to take thyroid hormones. So the good news, so there's generic forms. I take the generic, and the generic form of the drug is very inexpensive. It's probably like a few cents per pill. So that's good. It's still, I mean, if you have no money, it's still inaccessible, but it's not expensive. If you want to take the trade drug, like a drug called Synthroid, it's like $1 a pill. Like there's a big difference. And you know, if you have the best insurance of the world or you had endless money, maybe you can take Synthroid. You know, in my experience, the levothyroxine works just as well. So I take the generic. I will say that because people's lives depend on the drug, like you can't live without it, it usually will be covered by things like Medicaid and Medicare. Like I'm in California, so Medi-Cal. There's no way if you register for Medi-Cal that you would not be covered if you don't have a thyroid to have thyroid hormone. Um, you know, when you're on a drug though and your life depends on it, the mistakes people make are like, they're like, I'm going to Europe, you know, I'm gonna put my thyroid hormone in my bag that I check. And then like United Airlines loses your bag. Like, you know, it's a drug, like I always keep it with me. Do you know what I mean? It's like sort of essential. So I'm very protective of my thyroid hormone. I always have extra. And the good news, because so many people are on it, like it's 23 or 24 million Americans take it, it's very hard to go anywhere in the developed world where you would not be able to find the hormone. But if you go to the developing world, and we have a lot of people who do missionary work and they decide they want to go to conquer Antarctica, like you have to be really careful because if you lose the drug or you wind up being snowed in, if you're without the drug for like a couple months, you could die. It's not like you'll die the next day or the next week or the next 2 weeks, but if it's a prolonged period, you could die. But that's usually like many weeks to a couple months.
Thank you.
All right. Thank you so much for your informative presentation. Dr. Sosa, we greatly appreciate your time and your generosity in answering all of our students' questions today. I'll be going over our wrap-up slide if that's okay. And you're free to leave whatever, or you can stay till the end.
All right. Thank you, everyone. I really appreciate your questions. Medicine is amazing. It's a calling, not a profession. Surgery is just magical. And I'm very grateful for having met all of you. I feel like we're all in good hands. I'll be well taken care of when I'm old and sick, okay? Bye, guys, and thank you for the hearts and the claps. Appreciate you. Ciao.
Thank you
Bye.
so much.
Bye.
Okay, I'll be starting our wrap-up presentation, so feel free to stay. Okay, let me just present this. Okay, perfect. Hopefully you all can see my screen. Again, thank you so much for staying for our presentation. We'd just like for everyone and encourage you all to reflect on the session today. We always encourage our students to keep a record of every activity they complete. So here are a few questions you can think of while you reflect. And next, while writing your reflection, if though it's not required, we encourage that you tag us and share your insight on LinkedIn. We are happy to repost this and help you expand your professional network. And next, again, if you want to be more involved in pre-health shadowing and get involved in our program, and we encourage you to visit our website. Here you can become a remote volunteer and get certified hours through professional nominations or graphic design, social media promotion, etc. We're always accepting team member application. So if you want to take a more active role in PHS, please check our website to lead projects and initiatives. It'll all be on there. And again, if you're able, please consider donating to our website. It costs a lot to keep this program free for everyone. So you can also help by spreading the word or volunteering your time. And the moment we've all been waiting for, just how to earn a digital certificate for your virtual shadowing if you haven't done so before. You would just go onto our website to find our professional course page that you use to access today's Zoom. Today, our professional was Dr. Julianne Sosa. So you would just take our quick 10-question multiple choice quiz based on the content from today. And for this reason, we allow 2 attempts to take the assessment because we understand that technology can be an issue. So you have up to 30 minutes to take and earn a 70% or higher to get your certificate. And we recommend waiting about like 30 minutes to an hour after the session to take the quiz, which will be open indefinitely. So there's no rush to take it, but we will have to upload it on our end first. And once you've passed, you just click finish course, and then you will be able to download your certificate for today's hours. And then lastly, if you've missed a part of our session or want to go back and view the session, please check our YouTube channel at Pre-Health Shadowing to watch any of our previous sessions for free. This way you can also like get previous certificates for your virtual shadowing hours. And be sure to catch our sessions every week. Our next let's see. Yes. Okay. Yeah. Be sure to catch our sessions every week. We have a few coming up in the next week. So be sure to check our website for those latest events and sessions. And thank you so much for joining us today. Please stick around if you have any questions for myself or any of the other members of the team. Lastly, we would just like to thank you all for donating your time with us. And yeah, enjoy the rest of your day. We hope to see you at our next session. Oh, yes. Okay, so the quiz is up, so no need to wait. The next session would be with Lorenzo Castellano on June 15th.